Does your dog keep scratching, licking its paw and giving off that strange smell? Or maybe your cat have scabs, hair loss and roaming the same spot over and over again until it's raw. Is it just allergies or your pets might actually have skin infection brewing under all that fur? Hi, my name is Kiran Bishnoi and today in this video we're going to talk about how to recognize different type of skin infection in dogs and cats, how to spot them early, what causes them, and most importantly, how to get that healthy and soft coat back and help your pet feel comfortable again. So as a pet owner, for any kind of skin infection, always look for these three things which might helpful when you get your pets to a doctor and which help in diagnosis. First thing you should look for is your dogs or cat have itching. If they have itching, what degree of itching they have. It is just mild itching or they have severe itching. The second thing is what type of lesion present in the body. Is it only redness, which is more common in the bacterial infection, or is it small tiny red bumps on the body, or the pus is coming from that red bumps, or do you notice any kind of scales, dandruff which is stick to the hair, or do you see excess hair fall? And lastly, is your dog's skin become thick, hard, black and giving off that offensive odor which is more common in the fungal infection. Third thing you should notice is where is the lesion located? Is it just generalized or present on a specific part of the body? Now we're going to discuss about some of the most common skin problems which is more prevalent in dogs and cats. So for the ease of understanding, we can classify skin diseases in two types. Allergic reaction or allergic disease, and second one is non-allergic or infectious disease. So allergic disease is generally caused by any kind of allergen which might be environmental, such as a house dust mite or flea, or maybe due to the food. Infectious disease or non-allergic disease is caused by any kind of infectious agent which could be a bacterial or fungal or maybe caused by any parasitic. So in this video, we're going to talk about three types of allergic diseases in the pets, which is Canine Atopic Dermatitis, CAD, Flea Allergy Dermatitis, which is FAD, and Adverse Food Reaction, AFR. And four types of infectious disease, which is more common. First one is Malassezia, which is a fungal disease, pyoderma, bacterial disease, Demodex, and Scabies, which is caused by mange. So based on the history of itching and site of lesion, we can somewhat tentatively diagnose the underlying cause, but still, a complete clinical examination and proper diagnostic test is still essential for coming at the exact cause of the disease. So if you notice your pet have severe itching, then it could be any kind of allergic disease or it could be a fungal disease, Malassezia dermatitis. If you notice your dog have minimum to no itching at all, then it could be a bacterial infection which is known as pyoderma, or it could be Demodex infection or a fungal infection which is known as dermatophytosis. The next thing we should look for is the site of lesion. So if you notice your dog have moist lesion with intense itching which is mainly located on the underside of neck or at the armpit area or at the groin area, then it could be Malassezia. And if the condition persists for a longer time, then you can see black hard skin with offensive odor, then which is a sign of chronic Malassezia dermatitis. If your dog have tendency to bite at the posterior part of the body, like at the tail or back region with the severe itching, and you notice the severe hair fall there with no apparent sign with the anterior half of the body, then it could be Flea Allergy Dermatitis, which is most common in dogs. And if you see the lesion around the anus with severe itching, then it could be due to any kind of food reaction which we termed as adverse food reaction. Lesion which present on the bony prominences such as at the ankle or at the bony points at the back of your dog's hip or at the scapula with severe itching, then it could be scabies. If you notice your dog have mild itching with the pustule and sometimes scab which is stick to the hair, then it could be a bacterial infection which we termed as pyoderma. So in the first part of video, we're going to talk about some of the most common allergic diseases, possible causes, common signs and symptoms you can notice, and possible treatment regimen with diet recommendation. First of all, we're going to talk about Canine Atopic Dermatitis, CAD. So if you notice your dog is 24-hour allergic to allergen and you have treated it multiple times, but after the stopping of the treatment it reoccurs, then it could be a CAD. So around 50% of the dermatological cases made up of CAD, which is due to the hypersensitivity to the aeroallergen, which could be seasonal, maybe due to the pollen grain, or maybe non-seasonal due to the house dust mite. So most of the common clinical signs you may notice is there is severe itching on the face or the ventral part of the body or at the extremities on legs. In almost 80% of the case, you might see the ear infection, which we termed as the otitis externa, which typically affect the inner surface of the ear and interdigital space. So along with the CAD, there might be the secondary bacterial or fungal infection is there. So even after the treating the condition, the skin lesion might subside, but the severe itching still persists. So talking about the treatment, CAD is hard to cure, but we can control it because you cannot protect your dog from environmental exposure of the allergen all the time, but quality of life can be improved by controlling the secondary bacterial or fungal infection. First thing to do is to avoid the exposure to allergen, which is practically not possible all the time, but you can reduce the exposure. You can put your dog on corticosteroid like methylprednisolone or cyclosporin, which is highly effective in reducing the itching, or you can use the antihistamine, which is somewhat helpful in reducing the signs, and using a proper antibiotic will help to cope up with the secondary bacterial infection. So using topical shampoo might aid in the control of CAD. There are so many topical shampoos available in the market with the immunomodulatory factors and with the linolenic acid, which help to restore the skin barrier, have soothing effect, and also having antibacterial and antifungal effect, which cope up with the secondary bacterial and fungal infection. So along with this diet, which is containing essential fatty acids like omega-3 or omega-6 and micronutrient, might help in the cases of itching, restore the skin barrier. So this is all about the canine atopic dermatitis. Now let's talk about the flea infestation or flea allergic dermatitis. So flea infestation is more common in the summer season, so sometimes we call it summer eczema. Flea saliva has so many proteins which cause the hypersensitivity in the skin of dog and cats. The most common clinical signs is the severe itching, mainly at the posterior part of the body like tail head or medial thigh or ventral side of the abdomen. Your dog might look restless and uncomfortable and spending so much time on scratching and licking mostly at the posterior part of the body with no apparent clinical sign on the anterior half of the body, then it could be a flea infestation. So to control the flea infestation, there are so many combinations of insecticidal and growth regulating product available in the market in the form of topical shampoos, collars, spot-ons, and spray. Spot-ons and line application containing permethrin and fipronil quickly disperse in the skin surface and provide an effective flea control. As for the itching, which could minimize with the use of corticosteroid and a successful parasiticidal therapy. So the next allergic disease we're going to talk about is adverse food reaction. As the name suggests, the causative agent is one of the food ingredient of your dog's diet. It could be milk, meat, egg, fish, or any kind of dairy product, or it could be cereal grains like wheat, rice, or soybean. So basically Labrador, Cocker Spaniel, and German Shepherd are at higher risk of having food allergies. As for the clinical sign, which is very similar to those of canine atopic dermatitis with intense itching, redness, papules mostly on the face, groin or axillary part, but the most typical and common clinical sign seen in the case of food reaction is intense itching around the anal region, which we usually call perirenal pruritus. Along with this, secondary dermatitis and gastrointestinal signs may observe like vomiting, diarrhea, abdominal pain, and flatulence. So as for the management of adverse food reaction, first we have to correctly diagnose it from other allergic diseases like atopic dermatitis and flea allergic dermatitis, since the treatment regimen is whole different from other allergic diseases. So usually food reaction is controlled by using elimination diet, which basically exclude all the previously given diet component, and this elimination diet must have a single protein and carbohydrate source like meat or vegetable. So after this elimination diet, we give provocative diet, which is basically giving the previous food ingredient one by one to identify the cause of food reaction. So as for the diet, there are so many hypoallergic canned food available in the market, but still a homemade diet is still preferred to control the food reaction. So giving a complete and balanced, highly digestible with minimal antigen diet, which does not contain any offending ingredient, will help to manage the adverse food reactions in your pets. So this is all about the allergic skin diseases in dog and cat. In the next video, we're gonna talk about the non-allergic or infectious disease in the dog and cat. So if you found this video helpful, don't forget to like, subscribe and comment, and let's meet in the next video.